Good evening and welcome to the February 2025 monthly meeting of the Community Service Committee of the City of Norwalk Common Council. We will call the meeting to order at 7:02 with roll call. I see Councilperson Sutton, Councilperson Witherstrand, Councilperson Smith, myself, Councilperson Ayers, and we do also have Councilperson Lopez, who is joining us, not a committee member. Excused at this time is Councilperson Burnett and Councilperson Heather Dunn. Are there any persons in the queue for public comment? If you wish to make public comment this evening on any of the action items listed on the agenda, please raise your virtual hand and we will acknowledge you. Upon being acknowledged, we ask that you state your full name and your address. Chief Daniels?
I do not see anyone, Madam Chair, that have identified to speak in public comment.
Okay, we will close public comments at this time. Moving right along, we will ask for the approval of the September 18th meeting. Um, all those in favor of approving those minutes, please raise your hand.
I actually would like to, I have two minor spelling errors.
Okay, you want to do that at this time, make those corrections at this time.
Yeah, just in the attendance, my name is misspelled. It should be with a Y. And then on page 2, in the middle of the page, Ms. Diamore's name is spelled wrong. It's an I instead of an E.
Okay, thank you for noting those corrections. Any other corrections at this time? All those in favor, raise your hand. Any opposed? Abstention, it is carried unanimously. Next, we will turn our meeting over to Chief Daniels with any updates. Chief?
I am juggling on things. Thank you so much. In terms of updates, I just want to share with the committee that I'm looking forward to sharing the results of the mental health analysis. The report is in its final draft, and I believe I sent it to the chair just so she can have a copy. We're going to assemble the team. We've had our partners from Silverhurst Hospital, Norwalk ACTS, the superintendent's office, and Norwalk Community Health Center. So this is more just an update to say that we're still moving along. The final report is done. Once we have a chance to look at it, I'm looking forward to next month of just sharing the work that we do. It was your support that made this happen, and talk about next steps, specific around how we want to use this report to let philanthropy and funders know that yes, the city is committed, but we know the city can't do it alone. And so we're looking for using this report to really elevate the need and the great work that is already happening. So with that, just want to say thank you in advance. Looking forward to next month of sharing, going a deeper dive with the mental health needs of our young people. And I'm just really excited about the partnership, and again, with your support and of course the mayor's support to make this happen. I think it's going to set Norwalk apart from our other communities throughout the towns and cities. So more to come, and I'm looking forward to next month to share the results. Thank you.
Thank you, Chief. Can we continue with our agenda? Action item A, Chief Daniels. Oh, I need to read it. Duh. Sorry. Action item 5A, Health Department. Authorize the mayor, Harry W. Railing, to execute any and all agreements, documents, instruments, and amendments as may be necessary to extend the student procurement internship agreement between.
Madam Chair, that should have been removed. Is that still on your document?
That's the one that I got this afternoon.
I was told we weren't moving that forward because it wasn't ready.
Okay.
Because Brian's not here. Brian, you're not here to speak on that, right? You're just doing your report.
Right.
All right, Brother Seaton.
Okay,
Yeah,
so
so I don't
if the
know.
committee would give me chairman some authority, can we just have Mr. Weeks at this time give his report?
Do
from
we
the
need
health
to
department.
officially remove that line item? Is there a protocol
I
for
will
that
go
or?
back. I'm gonna go
Okay,
back when we do that and do that.
okay,
But can
you got it.
at this time, can Mr. Weeks please give his presentation on behalf of the health department, Mr. Weeks?
Thank you.
Sure. And thank you for this opportunity, everybody. So yeah, this is just a quick update on the respiratory virus and illness situation. So what I will do is just kind of, as you guys may recall, just kind of the stereotypical presentation, pulling up the CDC web pages and kind of just giving us an overview of what's going on. So just give me a second to share my screen and we could jump right into it. All right. So as you're seeing, this is the CDC Respiratory Illnesses Data Channel. This is still updated, fortunately, with all the other things that we have to kind of consider at the federal level with communications coming from Health and Human Services, CDC, and other sources. But with that said, this is just like a quick snapshot or overview of what's going on. So the CDC has done a really great job to kind of summarize this and make this information, the infographics, very straightforward and easy to interpret. And so with that said, we are currently looking at the situation for the national level, so the United States. And you can see right here, especially this red bar here that's mentioning high, overall respiratory illness activity in the United States remains high. You know, it's 'tis the season, we're in the winter time, so this is to be expected. And with that, then the CDC breaks it down for emergency department visit levels and then also wastewater viral activity levels. So looking first at the emergency department visits, we can see the highest or very high right now is for influenza, and that's currently on increasing trend. But then we can also see that's followed by respiratory syncytial virus, or RSV as we know it, and that's at moderate or decreasing trends. And then COVID-19, that's at low or decreasing trends. And again, you want to keep in mind what emergency department visits means. That is people going to the ER for, you know, some sort of respiratory condition and they're getting tested, and hence it influences this data. The important thing to consider here is this is severe illness, right? Somebody has to go to the hospital or want to go to the hospital because they're presenting with symptoms justifying that. And so with that, another way to get that perspective is the wastewater viral activity levels for the country. And so that is indicating just anybody is shedding the virus. So, right, they can experience any level of illness, whether that is severe illness or it could be moderate or even asymptomatic presentation. So this is a really good indicator because somebody, in order to shed the virus, they have to be infected. This is a really good measure, and this has come out from the pandemic in terms of giving us a better idea what's going on. So with that said, looking at influenza, that's also very high, so that's further supporting the emergency department visit data. You know, COVID-19 is actually at high relative to the wastewater viral activity levels, then RSV is at low. So another important thing with the wastewater viral activity levels, it also can be a predictor of what's to come. Because this is, again, somebody's experiencing illness, but then it progressively gets worse and then may result in the emergency department visit. So it's a really good prelude and indicator of what to expect. So again, we're seeing flu at very high levels. We're seeing currently emergency department visits at very high levels too, and an increasing trend. We are seeing wastewater viral activity at high for COVID, which is an increase from just even a couple of weeks ago reporting. So what we can potentially anticipate is COVID-19 emergency department visits may be increasing. And this is par for the course because we are progressively getting towards spring break. You know, it happens usually in late February and, you know, most of March. And so typically we usually see a bump in COVID-19 activity. So we should probably anticipate this and again, prepare ourselves for it, even though we're in the midst of very high flu activity. So with that said, I'll just quickly summarize what's going on in the state of Connecticut, though. Again, our overall respiratory illness activity is high, very high for flu, and increasing trend again for emergency department visits, but low and decreasing for COVID-19 and RSV. Again, that's ED visits. When you look at it for wastewater viral activity, we have very high for COVID-19, which is a big change because we used to be very high for flu. It's high for flu now, and it's low for RSV. So we're kind of seeing a switch here. And this does happen during this time again in the year, like I mentioned with spring break. So we should just kind of anticipate that. And then you can look at this data. You know, this is actually like a line chart looking at it for the emergency department visits for the big three again, COVID-19, flu, and RSV. You can look over on the right-hand side here with my mouse cursor is. This is, again, looking at the national level. You can see how COVID-19 and RSV, which is orange and the purplish color respectively, are much lower in comparison and proportion of these emergency department visits compared to influenza. But nonetheless, they're kind of hanging in there. You know, RSV being a little bit more of a downtrend versus, COVID-19, which is kind of almost kind of holding at a level, at a plateau of sorts. And then you can see flu here kind of just indicating its first data point of a dip, which is good news, but it shouldn't create the false of any hope yet. Usually to have a trend really present reliably, usually you want to have at least 3 data points. So this is a good sign, but we have to kind of play this out because, again, you've probably been seeing in the news a lot just how, kind of we have historically high flu levels for, the last couple of years. So it's just something important for us to kind of be mindful of as we navigate things. Then when we look at it and zoom in for the state of Connecticut, you can see mostly the same story. RSV activity and COVID activity kind of hanging much lower in comparison to flu. RSV having more of a downtrend versus the COVID-19. But again, when you look at this proportion, it's still kind of hanging steady. And as we were seeing with the wastewater viral activity, not a good indicator of what potentially may be to come. And then when you look at influenza, again, it's only has 1 data point indicating at least a potential peak. We have to kind of see how this plays out. But as you can see, we're almost at 10% in terms of emergency department visits, which is pretty high. As you can see, even with like last year, just how much lower it was in comparison for influenza. So this is just another important point for us to kind of take away from this, like as I mentioned with the historical highs. So with that said, besides the big 3, there's also a lot of other, viruses, bacteria that can result in respiratory illness conditions. So this is another surveillance from the CDC. This is called the NREVSS. This is just a really great way to kind of summarize what's going on from weekly percent of positive tests for these different, respiratory pathogens. And so this is looking at, again, for the national level. If we look here over in the most recent data point, which is again in February, we see the highest is blue, which is influenza, which is what we're seeing also for the big 3, followed by rhinovirus and enterovirus. So especially rhinovirus is the common cold. So we're seeing that also as number 2 behind influenza. And then you can see kind of the mixture of the data points relative to RSV. We also have just the regular human coronaviruses. So this is not COVID-19. This is just like the regular circulating coronaviruses. They also contribute to the common cold. Along with that, SARS-CoV-2, which causes COVID-19, kind of closely following behind. So we also have some other kind of lesser known viruses that you may have also heard of, like the human metapneumovirus, which got a lot of publicity back in November or December regarding, like a large outbreak that was going on in China. But again, these viruses and these bacteria, pathogens in general, succeed well in the wintertime, especially, as we get, this cold weather, like the chill we're having today, they're going to have better opportunities to proliferate. They do come in at different times, right? With influenza, you get type A, then type B eventually enters the picture, which is par for the course right now, what we're seeing too. SARS-CoV-2 has a peak also during the wintertime, but our bigger peak was actually during, the late summer, around there. So it was actually kind of interesting seeing that present. So it kind of delayed COVID's presentation, but we should anticipate it's going to pick up again in, the spring break time. And then, along with that, rhinovirus, pops up too. And then also human metapneumovirus shows up a little bit later in the season, but it does happen. It's rarer. Technically, most individuals are exposed to it at some point. They usually present with mild illness that mirrors the common cold, but there's some people, especially, really young or elderly, or those that are immunocompromised or immunosuppressed, that may require hospitalization. So that's why it's important to just obviously follow the prevention measures, which I'm just going to jump into a little bit after this. So that's one side of the picture. The other thing I'll just throw in here really quickly, the other great thing about this dashboard from the CDC is it also shows norovirus. So this is the weekly positive test for the national level for norovirus. And you can see that we were peaking around January. Right now, it is showing a little bit of a smaller curve relative to that, but still activity is very high. So we want to be mindful of that. And you might have heard the terminology, the quademic, right? So that was COVID, flu, RSV, and norovirus circulating. And that's still the situation right now because this is the season for it. And norovirus, as you'll typically see, goes on for a while now until probably like April, May. So it will be downtrending, but it will still be presenting. And, you have these outbreaks because it's just so successful in transmitting in these kind of cluster scenarios. So that's just a little side note there, but it's just a really cool dashboard. And then with that said, there's also something like walking pneumonia. So this is another important one because this is bacterial related. And this is also circulating in the mix here too. And what we're seeing in this visual is the percentage of pneumonia-associated ED visits related to walking pneumonia, Mycoplasma pneumoniae, which is the bacteria that causes it. And what you're seeing with these three trend lines here, the green, orange, and blue, that's indicating more or less pediatric age group, so less than 18 years of age. The highest is the 5 to 17-year-old age group. Again, looking at the national level, so this is circulating in the mix here too. So this is just, again, just an overall message and mindfulness that we need to get through the season. We have a lot of things that happen. It happens all the time at different levels, but we want to get through the season because, with the groundhog seeing its shadow, kind of prolonging winter as evident, but hopefully with a little bit later in a week or two, we get a little bit better weather. That should help mitigate that to some degree. But again, as we were looking at the data, you'll see that more reflected in the wastewater viral activity and eventually the ED visits. But, typically illness presents for 2+ days for individuals. It can be 4 days, it can be 5 days, it can be a week or 2 weeks for some individuals, especially as they recuperate, because, some of these effects, if you get pneumonia, especially, or bronchitis, that could take weeks or months to heal. And get over it. Although you're not infectious if you're treated appropriately, if it's a bacterial secondary infection that's causing it. So anyways, not to get on that because that's a whole nother thing too, is secondary infection. So somebody may present with influenza or COVID-19, then they get a secondary bacterial infection in their upper respiratory area or even deeper in their lungs, and therefore also need treatment with, antibiotics. Or as well as, other viruses that enter the picture too, because their body is also weakened at that time. So these are all things we're trying to navigate. So this all boils down to this really good infographic that I've mentioned in the past, and I don't mean to kind of beat this home too many times, but it's really the best thing that anybody can follow. It's really helpful, and I'm really happy the CDC has done this. This is another lesson learned that came out of the pandemic. And so again, we have core prevention strategies, right? Getting your immunizations that you can get, for COVID-19, for RSV, for flu, within the appropriate time window too, in preparation for the season as well as during the season. So it still applies because we're getting through this, right? But then be mindful that it takes about 2 weeks to develop that immunity from that vaccine to get its maximal effectiveness. So be mindful of that too. It's not instantaneous. You get a shield, and we're familiar with all that kind of terminology and phrases too out of the pandemic. But I just want to hit that home because that's one of our best prevention strategies. But along with that, hand hygiene, respiratory etiquette. So, washing your hands, especially in the case of norovirus, because hand sanitizers are not as effective. But if you have only hand sanitizer available, doing that, but washing your hands right away as soon as you can. Then, respiratory etiquette, coffee into your elbow, all that good stuff that we learned. Then along with that, clean air. So where you can get HEPA filters, especially MERV 13 or better, those actually can filter out these pathogens to reduce their, presence inside, the area that somebody's, where the filters are operating. Then along with it, obviously opening up your windows where appropriate, now with the weather as it is, that's going to be a little difficult to do, but that's where these filters are really helpful. Then along with that, seeking treatments, there's antivirals for influenza, there's antivirals for COVID. If you're eligible, again, follow the healthcare provider to be prescribed or get their medical advice relative to that. And then another important one that's kind of caused the spread to kind of continue, as we're familiar with the chains of transmission, staying home and preventing that spread. So, stay home and away from others until your symptoms are better and you're fever-free without any sort of fever-reducing medication for 24 hours. Then from there, you follow these precautions, these 3 important precautions for 5 days. What are they? They are masking, right? So masking is going to help reduce that viral load that's transmitted into the air, especially if you go back to work or you go back to normal routine or social activities, that it reduces the opportunity for somebody to get enough exposure that they're going to then present and then transmit to others, and then that cycle continues. Distancing where you can, definitely distance, especially from those that are vulnerable, especially like, your elderly parents or, somebody else that, don't go to a senior center right after, you just got into day 2 of this, after that 24 hours or day 1. It's not a good idea, right? You want to reduce that risk of transmitting to others that are especially vulnerable to the illness. And then also testing, right? For COVID-19, we do have the rapid tests. And so if your rapid test is testing positive, that means you are still infectious because the test is testing for proteins that the virus produces and is unique to it. So if it is testing positive, is it indicative that you're transmitting enough of a viral load, you could transmit it to another individual. So if that's still positive, you kind of repeat the cycle in this message as well. So again, I think it summarizes it really well. Just hitting those core prevention strategies at home And, everybody just do their part to kind of mitigate this and get us through this so we can enjoy our springtime and then consequently the summertime. So that's overall just my kind of overview for the respiratory illness situation here for the nationwide, Connecticut, and locally what we can kind of do. And again, it's very nicely summarized with this visual. Thank you.
Awesome. Thank you so much. And Madam Chair, again, just want to highlight the great work that we have in Brian. He also, and I would encourage our Common Council and the public that may watch it. There's a lot of resources on the Health Department's website, and Brian has personally created many of the tools that we can really get a point in time of what's happening in our city. So Brian, thank you so much. We're excited to have him here. I know Barbara was here, and I'm not sure if you, Madam Chair, was here that when we brought him in and was able to make him full-time employee with all the things. So we're really excited. And this is an example of good investment to make sure our city is healthy and we know what's going on. So Madam Chair, I'll turn it back to you. I asked Brian to stay a couple of minutes if there's any questions from the Common Council. On behalf of Brian, he'll be happy to answer them because I can't. Thank you, Brian. Thank you, Madam Chair.
Do any of my colleagues have any questions at this time? Yes, Councilperson Witherstrand.
I just have a quick question, and thank you very much, Mr. Weeks, for that presentation. It was really helpful. I just wondered if there are any stats in terms of vaccination rates. Do we know either on the city or the state or the CDC level, is there any tracking in terms of the trends in the population in terms of people getting their vaccination, and does that have any impact on the levels?
Yes, no, it's an excellent question. So there is some tracking that does exist. The state health department does maintain a database for especially pediatric vaccinations. So we do monitor those trends, as well as the CDC does have that, but it's encountered some issues in terms of data updates. I'll leave it at that. With that said, uptake for especially the influenza and the COVID-19 vaccines, and including also the RSV vaccine, has been low. And so we've seen it generally each year, get a little bit lower or be a little bit slower in terms of uptake. And so, again, with kind of current obstacles that we're navigating with messaging and communication, it has made things a little bit difficult. But nonetheless, we have done our own campaigns here at the health department. We have hosted, flu vaccine clinics. We do publicizing on social media, as well as, just different opportunities that we do in the community to promote the vaccine and get the word out there. So we're doing our part. We also work with our healthcare providers in the community to get that word out there. But again, unfortunately, especially with the seasonal vaccines, uptake, there is the burnout rate relative to it because somebody has to get it every year. It's just, there's just a lot of those caveats that we have been navigating, and we're trying to find every which way to reach everybody, but they also have their mind made up, more or less. And so we're trying to reach those that are still on the fence, and also convince those that, that also may not be aware of, or maybe have absorbed a lot more of the messaging relative to it. And so we're just trying to reach everybody, but nonetheless, it is a difficult uphill battle. And the trends have not been great with the uptake this season around. But we're hoping for the best as we continue forward, especially navigating the kind of labyrinth of things that are kind of going on right now.
Thank you for that.
Councilperson Smith?
Thank you, Chair Ayers. You may not have an answer to this question, but I'm just curious if there has been any talk or any indication that at some point the COVID vaccine will be available in our doctor's offices. So I know when I go for my annual physical, it's usually, November, December, right? And so that's where I get my flu shot because my doctor's got the flu shot. Do we foresee a time that the COVID vaccine would be available in that way, or is it always going to be at the local pharmacy?
My understanding, it's a matter of which doctor's offices opt in to do that. And so that's my current understanding. I'll double check that because I'm not involved in that component of the work and the outreach. But nonetheless, it's kind of a variable field. But you find that the flu vaccine is a little bit more common in these physician practices. But yeah, the pharmacies have become the de facto resource. There's actually was an interesting infographic from the CDC. I don't have it pulled up right now, where it shows that the doctor's offices and the pharmacies are the most trusted places right now for a lot of the public to seek out and get their vaccines. And so it's also incumbent upon these doctors to communicate that to their patients if they're not offering the vaccine, to provide them a list of where they can kind of go. The CDC does actually have a link where somebody can find the closest place to get these vaccines and things of that nature. Again, running through those obstacles with those web pages kind of being affected. But nonetheless, it's just a matter of these individuals wanting to do it, and also just, again, the physician or whoever their most trusted provider of information in the healthcare arena is conveying that. So that's another thing. But we work very closely with them. We actually have our own, immunization kind of coordinator here too that engages all these physician practices as we look into the pediatric uptake numbers and also try to get that outreach there too. So, we're trying to do our part and then hoping that everybody else does their part in terms of protecting everybody else too and themselves too in terms of their health.
Absolutely. Thanks so much, Brian.
Yeah, no problem.
Any other comments or questions? Okay, Mr. Weeks, we thank you again for your presentation.
Thank you very much.
So I have to apologize. I was looking at the wrong agenda. I'm so sorry, but I got my whole life together right now. So as we move on to section 5A action items, 5A is to authorize the mayor, Harry W. Railing, to execute any and all agreements, documents, instruments, or amendments as may be necessary with the local prevention council in the amount of $20,000, account noted, to the fiduciary Positive Directions, 90 Post Road West, Westport, Connecticut, 06880, care of the Norwalk Partnership. Chief Daniels, you would like to
Yes,
speak to
hi.
this?
Thank you so much. So tonight, I'm presenting this action item for your consideration on behalf of the Community Services Department. This item seeks approval for $20,000, which is the City of Norwalk's local contribution to support the Norwalk Local Prevention Council. As a reminder, we presented on this before, and the LPC, the Local Prevention Council, has now integrated into what is called the Norwalk Partnership, and Margaret Watts, the project director, can expand on that if there's any questions. And the main goal is to ensure that all the goals and initiatives are embedded within a comprehensive citywide approach to prevention, specifically for our community. So tonight, I am in full support of this funding. We have a strong relationship with the Norwalk Partnership and through our Human Services Department, and allowing for this continued collaboration in addressing prevention needs here in our city. The Local Prevention Council is charged with increasing public awareness around alcohol, tobacco, and other drug prevention use, and they develop and implement a variety of local prevention strategies that Margaret will be able to focus on. So again, thank you for this opportunity. This funding has been allocated for many years. That also predates my tenure, and I am supporting it even this year. This is an annual allocation. I do want to highlight that the funding, the Local Prevention Council also receives seed money from the state of Connecticut, but most certainly the city's local contribution definitely helps out a lot with a modest $20,000 for them to promote prevention throughout the city. So with that said, Madam Chair, I would like to introduce Margaret Watts, our project coordinator, and just give a high-level overview. She's no stranger to us. She's no stranger in this city, but definitely to some of our new council members, the goal, intent, and some of the things I know the council, Madam Chair asked, would like to highlight and just really speak to how the city funding is used, particularly the $20,000. So good evening, Margaret, and thank you, and the floor is yours.
Thank you, Chief Daniels, and good evening, everybody. Nice to see you. I think I know most of you. As Lamont said, I'm Margaret Watt. I'm the Prevention Director at Positive Directions, the Center for Prevention and Counseling. I'm a Norwalk resident, parent of a couple kids who've gone through the whole school system here, and I'm part of the leadership team of the Norwalk Partnership, which we also call TNP for short. So I'm really happy to be here to talk to you. I'm going to first explain what the Norwalk Partnership really is. When Lamont says it's Norwalk's Local Prevention Council, what does that mean? What do we do? How do we do it? And then how the city's contributions support, or how the community services funding supports all of our coalition work. So first of all, the Norwalk Partnership's mission is to prevent substance misuse and promote mental wellness in Norwalk youth and young adults. And we do this not as an organization, it's not a nonprofit, but rather we are a coalition of community members and organizations, most of whom are donating their time. In fact, last year alone, we had 116 individuals and several dozen organizations who helped us carry out our work. So there's a huge coordinating aspect to this, right? We reached over 10,000 residents, including almost all high school students, directly with films, trainings, events, and legislative advocacy. We reached an estimated 36,000 people, which I guess is probably more than a third of the city, with awareness materials and resources. And our mass media and online awareness touched 1.7 million. I'm very proud to say that in December, just 2 months ago, we were awarded Coalition of the Year by the Connecticut Association of Prevention Professionals. So all the work that we do when we're reaching all these folks is evidence-based. We follow the national public health model for prevention. That means that we are required to involve 12 stakeholder groups in our work: youth, parents, schools, city, law enforcement, healthcare, substance use, nonprofits, businesses, youth serving agencies, civic groups, religious and fraternal groups, and media. And we base our work on the 7 strategies for community change, which is a prevention model or a public health model. Everything starts from our biannual youth survey, which I hope you all are familiar with. This fall, we just completed our 4th survey cycle, and I just started presenting the results to the BOE and our coalition a couple weeks ago in January. We surveyed almost 4,000 Norwalk students in 7th through 12th grades, which is really an incredibly robust survey. And it's one thing that's really amazing is we have tons of good news about the direction everything's headed as a result of all the efforts of the partnerships across the city. But one thing I want to say about the survey alone is it's one of the big signature pieces of our work. It's incredibly valuable, not just for the Norwalk Partnership, but to the whole city. We gather information on student lifestyles, protective factors, risk factors, mental health, substance use, and other behaviors, such as their perspective on technology. The data has led to many outcomes, such as the schools contracting with community providers to increase critical mental health and substance services in the schools. Nonprofits such as Mid-Fairfield and others have gotten grants to fill gaps. We've created the annual Day of Training, which provides the necessary social emotional development skills to adults throughout the city who work with our youth. And the results inform teachers, parents, youth, and lawmakers. So our survey alone is a tremendous asset to our community. And right now we're in the middle of doing a deeper dive into the data and through some focus groups coming up to look at the needs of our most vulnerable populations. Then all this data goes to drive TNP's work. I mentioned 7 strategies that's the model we follow. So that includes providing information, skills development, support groups for youth and families, addressing access to substances, ensuring consequences that are restorative and equitable, addressing physical design, and improving policies. I'm going to give you a couple of examples of some of the things that we do that you may have heard of. Number one, you may be familiar with our signature event, the annual Norwalk for Mental Health, Norwalk for Mental Health. So there's an awareness walk and a big wellness fair last year with 50 agencies providing free behavioral health screenings, resources, tips, activities, music, speakers, etc. And the walk part is led by our students. We have a youth coalition, which used to be called Norwalk Strong. You may have heard of it that way. It's now called TNP Teens. We have our Teen Nights Out initiative, which Community Services has separately supported through funding, and that provides social and substance-free activities for youth for our high school kids. We have a liquor stickers campaign, annual advocacy forums, which have led to improved state and local laws, such as around THC beverages and the issue of smoke shops that are selling cannabis illicitly. We've created support groups for higher risk kids, including a free summer program we offered at West Rocks last year. And these are just examples of some of the most visible things. We provide trainings throughout every year on cannabis, overdose, parenting for prevention, mental health. We train students in all our high schools on suicide prevention so that they can support their peers. We organize film screenings and wellness fairs at schools. We provide awareness messages that you may have seen on buses or at the mall. And we make Narcan available, which, you know, is the, it revives people after an opioid overdose. We make Narcan available through community trainings, outreach to bars and restaurants, and soon you're going to see 10 Nalox boxes around the city available for public use. So that was to give you a sense of all the things we do. It's a lot. And really, we make it happen with a patchwork of funding. So the community services funds with other funds all go into a pot together. The only guaranteed prevention funding for Norwalk is the state money that Lamond referred to, which is the annual LPC or Local Prevention Council grant. That's under $9,000 a year. So as you can imagine, everything I described takes a lot more than that. We have been able to seek out and manage additional but time-limited grants to support this work. But to give you an example, the state money is only allowed to be used for vaping. The state opioid response mini grant is only allowed to be used for opioids, and that's $5,000. We have the drug-free communities grant from CDC only for alcohol and cannabis. And yet, so much of our data, so much of our work seeks to address root causes like mental health, which are the primary issues that we see in our youth data, mental health and suicide. That work isn't funded at all. That's why the community services funding has been amazing in helping us fill gaps in funding and support all the work that I described. Last year, we used it to help support our walk event, survey data analysis, our summer program, awareness and advertising, and also let's not forget food for our teen meetings, because we have 2 teen meetings a week, one at each high school building throughout the school year. And we're not allowed to fund that. This year, the funds will support communications, data work, ad buys, trainings and curriculum, our youth coalition, and support, coordination of our effort with youth, the walk, et cetera. So I just want to thank you so much for this funding and say it does offer us more flexibility than the other grants. And it's especially important right now in the current environment because other funding isn't assured. And I particularly want to thank Chief Daniels for bringing back the city's former and longstanding commitment to supporting local prevention work. I heard you say that it's a modest contribution, but what's really modest is the state's contribution, which is under $9,000 a year, which is really the only thing we can count on otherwise. And I'd like to think as a community resident and parent in town that we, you know, I'm really proud of the difference we make. And I hope that we can always continue to commit to making this kind of a difference. So thank you. And I'm open to questions.
Okay, thank you, Mrs. Watts. Does any of my colleagues have questions for the presentation that we just heard? Councilperson Smith?
No particular questions, but other than just say thank you, Margaret. You know, just to hear you run through everything you do, it's just, it's extraordinary. Your outreach to our kids and the focus on prevention. So actually, I did think of one thing. How is the teen night out going? Because you know we were so excited about that, and you know, and we talked about making sure it's not at the schools and everything. So is it still? I know you know at the outset it was really popular. Is it still as popular as it was?
They're still going on. It's funny because the money has not run out because, you know, at first we thought, oh, we'll have 2 a month, but then it takes, by the time you promote it and plan it and whatever, it's like 1 a month. Every once in a while they get canceled because either not enough show ups or like we had an outdoor thing that got, you know, thunderstorms. We just had 3 in December and January. For one of them alone, 187 students signed up. I say how many signed up because we usually have like a 50% show rate, but you know, that's okay. They're teens. I get it. So different. We've kind of learned which types of things are the most popular, which are, you know, ice skating is always super popular. Bowling is popular. We also talk a lot with the teens about, you know, things that they say they want to do and then don't show up for, like the dance that we had in January. And I think some of that, like a lot of us talk about how some of these things really reflect some of the mental health and social struggles that kids are still having. And you're putting yourself out there more at a dance than you are bowling, right? And so we actually have we aren't doing one this month, and we actually have a planning meeting coming up where we want to look at Do we want to bring back a few of the smaller events that are really focused on kids who are really trying to find a friend group? You know, because we really have always tried to have a mix of things for the people who are social and not social and quiet and loud and physical and musical and whatever. But it's been amazing. And we do continue to talk about whether we could also do this at the middle school level. And that is one of the things on our boilerplate with community services funding, right?
Wonderful, thank you.
Thanks.
Councilperson Witherspoon.
Thank you, Madam Chair. I'll lower my hand. I just want to echo what Councilperson Smith said, and thank you, Margaret, for the presentation. And I am a very new member of the council, and I'm also relatively new to living in Norwalk, very happily, and just very, very excited to hear about what you're doing, and very grateful for the work that you do in prevention, which is so important. And kind of highlighting the value of these in-person opportunities for young people to come together and experience that, which kind of makes me think about the impact of COVID on middle school and high school kids, and how some kids have sort of missed out on some crucial building blocks of social connection. And I think running these programs, even if they're not as well attended, is still, a priority to give opportunities for that, because it's an actual skill that they build,
Right.
right?
For sure. For
So
sure.
thank you so much for everything you're doing.
Thank you. And I'll add our survey data, which I have, like I said, I started presenting it out. It's not on our website right now because we are getting conflicting messages from CDC as to whether we can post our youth survey data right now. So be on the lookout for additional presentations. But the data is showing that kids' mental health, which was really horrendous when we surveyed in 2020, has gotten a lot better. But we are seeing exactly what you just said, Councilwoman, about there's sort of population groups that really their social skills aren't there. They're, some are doing better than others, but also let's not forget the impact of technology, because you don't have to develop those skills anymore if you can hide behind a phone, right? When you're feeling awkward.
Any other questions?
Madam Chair,
Okay.
I just want to clarify something. Let me know when, if there's more questions.
I don't see any. I just want to say thank you to the partnership and their components, their parents that participate, that drop kids off, the chaperones that participate with these different activities, even the schools for allowing the surveys to happen. We thank
Yes.
them for organizing the partnership in different facets. And as common councils, we do appreciate that hands-on, one-on-one work that you do and your staff does. So we did like to say that. Chief, you had something else to
Yes,
add?
thank you. So from an administrative perspective, this is an annual grant that comes from our department. I did speak with the chair. I did put a request in for fiscal 26. So I'm hoping for your support as we go through our budget process. Our budget process doesn't allow us to do line items in this way, but it does allow me to request it annually. So I'm just, through the chair and through this committee, I do ask for your support. As I pointed out, we have a strong partnership with the partnership. Anna Vivian, our human services director, actually sits on the leadership team. So we're monitoring, because we do, and I think you've heard me say this many, many times, I take the responsibility of shepherding taxpayers' dollars very seriously, and continue to do that. And so it is being requested for fiscal 26, and I ask for your support for next year. So this is an annual grant that we have to ask for every year through our city budget process. So thank you.
Okay, any other questions, comments, or concerns? Hearing and seeing none, I will call for the question. All those in favor, raise your hand. Any opposed or abstentions? It is passed unanimous. Please let us document at this time that Councilperson Heather Dunn did join us at 7:31. Okay, so that did pass unanimously, and we thank you. All
Thank you.
right, can I have a motion to adjourn? I love our committee. We're
Motion
so
to-
efficient.
The best. A
Thank you
motion
so
to-
much. Thank you all again, always.
Thank you,
Thank you.
everybody.
Okay,
You,
so the
Lamont.
motion,
Thank
wait,
you.
we didn't pass the motion to adjourn. The motion has been raised. All in favor, raise your hand. Any opposed? Okay, now, good night, everybody.
Thank you all so much. I
Thank
always
you so
appreciate your
much.
support. Thank you. Bye-bye.
Bye.